Hey team, there's been a lot of news about the coronavirus, so I just wanted to give a little bit of an update and some information that may be useful. The coronavirus currently, very high population of people within Wuhan in China. What is important to note that within Southeast Asia, there is a large number of cases, probably more than is being reported. So it will show up with sneezing, cough, and fevers. May not necessarily have the fever, but people can be infectious before they develop these symptoms. What is key points are is that if you have a fever, if you have a cough, if you have sneezing, that's a potential risk. However, if you have been in China, Southeast Asia, or in contact with people who have been in China and Southeast Asia recently, and you have fever, cough, that is a much higher level of risk for the coronavirus. It is important that you see a doctor. Now, before you go to your GP, before you go to the emergency department, it is very important that you phone ahead so they can be prepared with masks and maybe a separate area for you to be reviewed. If you just turn up, remember that there can be very unwell people within the waiting room at the hospital. There can be very unwell people within the waiting room at your GP. If you just rock up and you're coughing and sneezing, there is a chance that those people could be exposed. So we want to reduce the risk of transmission. So how do we reduce the risk of transmission? The key point is if you are coughing and sneezing, cough and sneeze either into a tissue and then throw it into the bin, or into your elbow, and that will reduce the amount of deposition of virus on your hands. This is the next point, is the way that the virus can also get into the body is in via the mouth with you eating using your hands, or in via the eye by rubbing of the eyes. So hand washing is key. All you basically need is some hand soap, water, and 20 seconds. How long is 20 seconds? That's as long as the alphabet song or the happy birthday song. Get in there, lots of warm water, lots of soap, and wash your hands frequently. If you do not have access to water or to soap, then the alcohol-based hand gels are as effective at a pinch, but not as good as washing your hands. Are masks of value when it comes to prevention? The answer is probably not. Unless they're fitted very tightly against your face, air can get in, and that includes droplets that have the virus on it. They do have a bit of a role in prevention in two different ways. If you're wearing a mask, it's harder for you to get your hand into your mouth, and it will remind you to wash your hands. The other thing is that if you are unwell, if you have a fever, cough, and sneezing, before going out into public, do wear a mask, because that will prevent you spreading it to other people. But I have to say, to be honest, the only people who are really benefiting from masks at the moment seem to be Amazon sellers. So masks, they have value in as much that if you are unwell, we would like you to wear a mask to reduce the amount of droplets that you may be spreading around. But the key is going to be hand washing and getting seen by a doctor with prior notice before you turn up to work out what the heck is going on. Of course, if there are changes in this, I will make further videos, but the key points are if you've been to China and you are unwell, seek medical attention. If you've been around people who have been to China and unwell, and you are unwell, seek medical attention. Currently at the moment, we do not have a vaccine for this virus, so it is going to be symptom control and making sure that we can get on top of reducing the spread. Hand washing really is going to be one of the major keys in this, and we can all participate in that. Hope that was helpful. Of course, if you have any questions, please place them below and I will do my best to get an answer to you. Have a great day. See you, team.